Power! Comrades, power!
A health professional strike that is expected to kick off from May 18, 2020 has faced opposition from the Kenya Medical Practitioners and Dentists Union just 2 days after the health professionals issued a 14-day strike notice. Leaders of the Kenya National Union of Nurses, Kenya Union of Clinical Officers, Kenya National Union of Medical Laboratory Officers, Kenya National Union of Pharmaceutical Technologists, and other cadres of healthcare workers had issued their intention to down their tools should their grievances fall on deaf ears by the employer, the Ministry of Health.
That even KMPDU, where they are conducting the tests, those guys have to go on a go-slow because the government is not paying them allowances. Kwani hii pesa ni ya kufanya kazi gani? Sisi tunaona tu ni chai watu wanakunywa pale.
Under the umbrella body of the Kenya Health Professional Society, which is chaired by Mohamed Duba, the healthcare professionals said that the government had sidelined them at a time when they are taking all risks to fight coronavirus.
Yes, we are representing over 50,000 health workers in this country. Last time we were called to appeals by the permanent secretary, and we were not given, we sorted audience so that we can be able to solve our issues very amicably.
However, KMPDU, led by Acting Secretary General Chibanzi Mwanchonda and Chairman Samuel Oroko, on Wednesday pleaded with their fellow health professionals to rescind their decision, citing the current COVID-19 pandemic in the country.
But what we are saying is that as KMPDU, we continue to dialogue with the government. We continue to say that in the time of a crisis, in the time of a pandemic, it's not the right time to engage in industrial action, because then we shall put the lives of Kenyans in danger.
In their strike notice, the medics are demanding harmonization of risk allowances to 30,000 shillings across all cadres, saying currently some workers get 20,000 shillings and others 3,000 shillings.
So you're saying it is not the right time, whereas the strike could be okay, but it is not the right time. Remember, Article 41 of the Constitution gives workers a right to go on strike when their issues are not being addressed. And our colleagues have raised varied concerns of issues which sometimes are historical and issues which sometimes are current. So whereas we support and agree with those concerns because they are varied, we are saying it is ill-timed, it is the wrong time for us to take our workers out of workplaces.
The medics have also been accusing the government of taking their health casually, not considering they are in the front line dealing with the coronavirus patients. Should the strike take effect, coronavirus patients in isolation centers and Kenyans in quarantine are likely to suffer, pulling back efforts reinforced by the government to contain the spread of the pandemic. Dickens Luvanda, Hope TV Newswatch in Nairobi County.